today is scapular adduction and depression. So the position that you want your patient in is prone, with their head turned to the opposite side and their shoulder in 130 degrees of abduction. So the motion that they're going to do is they're just going to use their arm like this. Okay. And to stabilize, you want to stabilize the opposite thorax here. And to palpate, you're going to palpate the lower traps between the spine of the scapula and the lower thoracic vertebrae. So go ahead and do that motion. Okay, good. So if they can do that, that's a grade 3. And then we'll do our resistance. So go back into the position. Raise your arm for me, please. Okay, so to provide the resistance, you're going to push on their scapula like this and try to break them out of that position. Good. Hold it. Good. Alright, so for gravity eliminated, there is no other position, so you're going to leave them in this position, and the grading is a little different, so there's no plus or minuses below a grade 3. So if they were only able to do partial range of motion, then that's a grade 2. If they couldn't do any motion, but you feel a contraction, then that's a grade 1. And no contraction and no movement is a grade 0. And things to consider, you want to make sure you're stabilizing because they could go into trunk rotation. And you want to watch to make sure that they're in the proper angle, because that could be a substitution if they're not. And they could also just use glenohumeral movement and instead of scapular movement. And also you want to make sure you're applying the resistance correctly, because it can be a little awkward to push on their scapula.